Okay, I want to talk a little bit, just for a second. Just want to talk for a second about kidney stones after the surgery. One of the things that's known as a complication after surgery is calcium oxalate kidney stones. Calcium oxalate kidney stones. And they occur because oxalate's in your diet. If you absorb it, it mixes with calcium in your urine to form stones. I have had kidney stones. You do not want kidney stones. They are bad. Well, there are some ways to prevent that. One, eat a diet that has less oxalate in it. Two, take your Tums, because the Tums will bind with the oxalate in your gut before it gets absorbed and can form a stone in your kidney. So that's what the Tums is for. Also, the citrate in citrus fruit will help bind the calcium in the urine and decrease kidney stones. So every morning we recommend a big glass of orange juice as opposed to a protein drink, and test that and drink orange juice with the citrate in it will help decrease kidney stones. And you can also talk to your doctor where they can give you some tablets of potassium citrate which can help decrease it. But those are the things we recommend long term to protect you from kidney stones.
When you say citrate, is that like calcium citrate?
No.
Oh, okay.
But good question. Let me see if I can explain that. Everybody who comes back to see me has stopped taking their Tums and they've started taking calcium citrate. That's because they don't listen to me. And they've had a friend who said, okay, calcium citrate is actually better for your bones because it's more absorbed and gets into the bloodstream and can help your bones. But we don't care about that as much because we can take as much calcium as we need. We want the calcium to stay in your gut where it can bind the oxalate. So we like calcium carbonate, which is what Tums are. Plus, calcium citrate is not an antacid. Tums, or calcium carbonate, is an antacid, can help protect you from ulcers, which is our really #1 complication. So we like to recommend Tums. It's not bad to take calcium citrate. Dr. Paragli, my associate in Florida, likes it, but he's wrong. It's the only thing in the world he's wrong about, but he's wrong about that. But he's going on the osteoporosis stuff. And so for protection against kidney stones, calcium carbonate in Tums, citrate in citrus fruit juice, like orange juice, grapefruit juice, and lemonade, things like that, not with artificial sweeteners. And also avoid oxalate in your diet.
So like, but it could be also like citrus fruits, the fresh ones.
Oh, very good. Yeah. There's a good article where they tested patients by drinking basically a glass of orange juice every morning, and that citrate did a tremendous job in decreasing the solubility product of the urine and stone former. So that's a really good way to do it. Plus, we like orange juice in general. Plus, we think it's good for, quote, the orange juice test, the infamous Dr. Rutledge orange juice test. Every morning, drink a glass of tart, fresh squeezed orange juice, and if it burns going down, call me and yell at me, because I've caused you an ulcer. Say, oh, you Dr. Rutledge, and the horse you rode in on.
What's the examples of oxalate foods?
Chocolate, spinach, and a couple of other things that I like.
There are, if you go to the internet, there are...
Just browse, but basically chocolate, spinach, and a couple of things. And those are okay, but especially if you're going to have some chocolate spinach tonight, you should have the Tums with that, because that'll keep the oxalate in the gut.
Okay, let's talk about that.
Yes?
Lots of cardiologists put him on a drug about a niacin, kind of statin, and the #1 side effect is ulcers, and I've been doing a little psychotic dance over this. What he's still taking it. What do you think of that?
I wouldn't. What's your cholesterol and your other numbers, you know?
Should have both gone under 150 or something like that.
He said he wanted to wash him out.
Yeah, well, well, niacin is good. I mean, we like niacin. Niacin is one of the few drugs in which not only does it help your blood pressure and your cholesterol and things like that, it raises your HDL, and it lengthens life. I mean, it's a drug. There's not many drugs that actually show they lengthen life, but niacin does. We think, though, in combination with our surgery, it's not wise. It's too much of a good thing. Mae West said too much of a good thing is just wonderful, and we say, not always. Too much of a good thing can be too much.
I have a question about the surgery. How do you determine what length you're going to do?
I have no idea what I'm doing. The tape is still on. I got to turn this off.